Good afternoon. Today we will deal with the histology of pituitary and suprarenal gland. So first we will see the histology of pituitary gland. So first we will see the pars anterior, which is a part of adenohypophysis. Pars anterior is otherwise known as pars distalis. In pars anterior you have cords of cells. You can see here there are cords of cells which are separated by fenestrated sinusoids. And these cells, using routine staining procedures, these cells can be divided into chromophil cells and chromophobe cells. Chromophil cells means they have affinity towards color. They take up color. So you can see pink stained and blue stained cells. They are chromophil cells. Whereas here you can see cells that are not taking up any color. They are chromophobe cells. They are phobic towards color. So they won't take up color. Okay. So in the pars anterior you have both chromophil cells and chromophobe cells, which are arranged as cords and are separated by fenestrated sinusoids. So chromophil cells, they usually have bright staining due to the granules in the cytoplasm, whereas in chromophobe cells the granules are not prominent, so they won't take up much color. Chromophil cells, depending upon which color they take up, they are divided into acidophilic cells and basophilic cells. Acidophilic cells take up acid dyes, that is, they stain with eosin, whereas basophilic cells, they take up basic dyes, that is, they stain with hematoxylin. Acidophilic cells are also called as alpha cells, and basophilic cells are also called as beta cells. So I repeat, acidophilic cells, they stain with acid dyes, like acid dyes like eosin. Basophilic cells, they stain with basic dyes like hematoxylin. So chromophil cells are divided into acidophilic cells and basophilic cells. So as I said earlier, these pink colored cells, they are taking up eosin, that's why they are pink in color. So they are acidophilic cells, whereas these blue colored cells which are taking up hematoxylin, they are basophilic cells. Acidophilic cells are also known as alpha cells and basophilic cells are also known as beta cells. Then you have chromophobe cells like this, which don't take up any color because they have very few granules. And in between you have fenestrated sinusoids. In this figure, again you can see this cell is taking up pink color, so that is an acidophilic cell. This cell is taking up blue color, so it is a basophilic cell, and this cell is not taking up much color, so it is a chromophobe cell. Both these cells are chromophilic cells and this is a chromophobe cell, and in between these cell cords you can see sinusoids, fenestrated sinusoids. So this is the histology of pars anterior of pituitary. So as I told you earlier, they contain vesicles, contain abundant dense cord vesicles in the cytoplasm, and they are divided into subtypes depending upon the size and shape of the granules. Now the acidophilic cells, that is the cells that are taking eosin, the pink colored cells, are divided into two, somatotrophs and mammotrophs. Mammotrophs are otherwise known as lactotrophs. The somatotrophs, they produce somatotropic hormone or the somatotropin or the growth hormone. As the name suggests, growth hormones controls the body growth. So as you can see here, this is the with the right amount of growth hormone you will have the normal stage. If there is too much growth hormone you will have gigantism, and if there is too little growth hormone you will have dwarfism. Okay. So that is somatotrophs. Somatotrophs release growth hormone. Then mammotrophs. Mammotrophs release mammotropic hormone or mammotropin or prolactin or lactogenic hormone or LTH. So this prolactin, it is involved in the growth and activity of the female mammary gland during pregnancy and lactation. So you have two types of acidophilic cells. You have somatotrophs and mammotrophs. Somatotrophs release growth hormone, mammotrophs release prolactin. Now coming to the types of basophilic cells, there are three types of basophilic cells. You have corticotropes, you have thyrotropes and gonadotropes. Corticotropes are also known as corticotropes. Thyrotropes are also known as thyrotropes. Gonadotropes are also known as gonadotropes or delta basophils. Now, corticotropes, they release corticotropic hormone or adrenocorticotropin or ACTH. So what ACTH does is ACTH stimulates the secretion of hormones of adrenal cortex. The cytoplasm of corticotropes are weakly basophilic and PAS positive. So ACTH causes secretion of hormones from the adrenal cortex. Then you have thyrotropes. Thyrotropes cause release of thyrotropic hormone or thyrotropin or TSH, which stimulate the activity of thyroid gland. Okay. So thyrotropes release thyroid stimulating hormone. Then you have gonadotropes. Gonadotropes release two types of hormones which have different action in male and female. So these two types of hormones are follicle stimulating hormone and luteinizing hormone. FSH and LH, follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone in females, as the name suggests, is involved in the stimulation of the ovarian follicles. It is a follicle stimulating hormone. So in females it is involved in the stimulation of ovarian follicles, leading to their growth, and also stimulate the secretion of estrogen by the ovaries. In male, the same follicle stimulating hormone will stimulate spermatogenesis. The luteinizing hormone in female will stimulate the maturation of corpus luteum, hence the name luteinizing hormone. It helps in the maturation of corpus luteum and also helps in the secretion of progesterone from corpus luteum. In male, the same hormone, the same luteinizing hormone, will stimulate the production of androgen by the interstitial cells of testes. Since luteinizing hormone is acting on the interstitial cells of testes, it is also known as interstitial cell stimulating hormone. So these were the chromophil cells. I repeat, chromophilic cells, they can be divided into acidophilic cells and basophilic cells. Acidophilic cells stain with eosin, basophilic cells will stain with hematoxylin, and you also have chromophobe cells which won't take up any stain because of the very few granules that are present. But they also have got divisions just like chromophils. There are cells that secrete growth hormone, there are cells that secrete prolactin. Among chromophobe cells itself, there are cells that are active, endocrinal active. So that was about pars anterior. Now we will deal with pars tuberalis. Pars tuberalis contain undifferentiated cells. Some acidophil and basophilic cells can also be seen. Coming to pars intermedia, again here you can see this is the pars anterior. You have cords of cells, and in between you have the fenestrator sinusoids. When coming to the pars intermedia is poorly developed, but it has got colloid filled vesicles. You can see the colloid filled vesicles in the pars intermedia. Pars intermedia is actually the remnant of the pouch of Rathke. If you remember, the anterior pituitary develops from the pouch of Rathke, which is a diverticulum from the ectodermal roof of stomody. So this pars intermedia is a remnant of pouch of Rathke, and it has got colloid filled vesicles. It also has beta cells, other secretory cells and chromophobe cells. Pars intermedia secretes MSH or the melanocyte stimulating hormone, which cause increased pigmentation of the skin. Melanocytes are responsible for the pigmentation of skin. So melanocyte stimulating hormone will cause increased pigmentation of the skin. Pars intermedia will also release ACTH. Okay. So pars intermedia, the important thing to remember is the presence of colloid filled vesicles. Coming to the pars posterior, in the pars posterior you have unmyelinated nerve fibers, and these nerve fibers are nerves which are arising from the supraoptic and paraventricular nuclei. Okay, and then you will also have supporting cells. These supporting cells are called pituocytes. So you have pars anterior with cords of cells with fenestrated sinusoids in between. You have pars intermediate with colloid filled vesicles, and you have pars posterior with unmyelinated nerve fibers. So this is how you have to draw. This is the pars anterior. In the pars anterior you have got cords of cells, and in between you have fenestrated sinusoids. And when you draw these cells, you have to draw acidophilic cells which are stained with eosin. You have to draw eosinophilic cells which are stained with basophilic cells which are stained with hematoxylin, and you have to draw cells which take up sparsely any stain. They are chromophores. Okay, and in between you have to draw sinusoids also. Then you have the pars intermedialis, where you have the colloid filled vesicles. Okay, these are the colloid filled vesicles. Then this is the pars posterior. You have to draw the pars posterior with unmyelinated nerve fibers, and you can also draw the pituitary, which are the supporting cells, pituitary, and also herring body. Herring body, if you remember, they are the nerve terminals which store the hormones. So you draw the unmyelinated nerve fibers, you draw the herring body, and also you can draw the pituitary. So that's what you have to draw in pituitary gland. Coming to the adrenal gland. Adrenal gland has got a connective tissue capsule. As you can see here, it has got a connective tissue capsule. Now from this capsule, septae will extend into the gland substance. The gland substance is divided into a superficial cortex and an inner medulla. Here you can see this is the capsule, and this whole thing is the cortex, and this is the medulla. So you can see from here itself that the volume of cortex is much more than that of the medulla. Actually, volume of cortex is about 10 times that of medulla. So in this figure also you can see this is the capsule, and you can see that capsule is sending septae into the gland substance. This whole thing is the cortex of suprarenal gland, and this is the medulla. And as you can see, the volume of medulla is much less compared to that of the cortex. So you have capsule, beneath that you have the cortex, beneath that you have the medulla. In cortex you have cells arranged in cords with sinusoids intervening between the cords. And the cortex has got 3 layers. You have zona glomerulosa, zona fasciculata, and zona reticularis. So here you can see this is the zona glomerulosa. Beneath the capsule you have zona glomerulosa, you have the zona fasciculata, and then you have the zona reticularis. Here you can see this is the zona glomerulosa, zona fasciculata, zona reticularis. These are the layers of cortex. First of all, about the zona glomerulosa. Zona glomerulosa, as you have seen already, it is the outermost layer. Here cells are arranged as inverted U-shaped formations or acinas-like group. It composes the outer 1/5 of the cortex. Cells are small, polyhedral or columnar with basophilic cytoplasm and deeply staining nuclei. So in this figure, this is the zona glomerulosa. The outermost layer comprises the 1/5 of the thickness. Okay, and you can see the cells that are arranged in inverted U-shaped manner, similar to that of an acinus, right? So this is the zona glomerulosa. So when you draw zona glomerulosa, this is how you draw. First draw the capsule. Beneath that you draw the zona glomerulosa in inverted U-shaped arrangement. The cells has to be in the inverted U-shaped arrangement, just like an acinus, similar to that of an acinus, and the cells should be basophilic. You have to use hematoxylin to stain the cytoplasm. Cytoplasm takes basophil stain, and you have deeply stained nuclei. Okay, so this is how you draw the zona glomerulosa. And coming to the zona fasciculata, In zona fasciculata, cells are arranged in straight columns, unlike that of zona glomerulosa, where cells are arranged in inverted U shape. In zona fasciculata, cells are arranged in straight columns. They are 2 cell thick, and sinusoids intervene between the columns, and it constitutes middle 3/5 of the cortex. These cells are large polyhedral with basophilic cytoplasm and vesicular nuclei. They are rich in lipids. So what happens is, because of the lipid content, with routine methods the lipid will dissolve out. So it will give a empty or vacuolated appearance to the cell. Actually, the cell contains lipids, and its lipids will get washed out during the routine methods of staining. During the processing of tissue. During the routine processing of tissue, the lipids will get dissolved out, so the cell will have an empty or vacuolated appearance. So here again, this is the capsule, this is the zona glomerulosa, and here you can see the zona fasciculata, and you can see the cords of cells. They are arranged linearly, they are 2 cell thick, and in between you have the sinusoids, right? So when you draw, this is the capsule, this is the zona glomerulosa, and this is the zona fasciculata. In zona fasciculata, you can draw it as 2 cell thick. Okay, draw it as 2 cell thick, and the cells, because during routine processing, the lipid will get washed off. These cells will have vacuolated appearance. Okay. So it is rich in lipid will get washed off, so you will get vacuolated appearance. So that's how you will draw zona fasciculata. In between you can draw the sinusoids. So draw 2 cell thick vacuolated cells, and in between you can draw the sinusoids. Now the zona reticularis is the innermost layer, constitutes 1/5 of the thickness. It is called zona reticularis because it forms a reticulum, which is made up of cords that branch and anastomose with each other. Here the cells are smaller, more acidophilic, and cells often contain brown pigment. So once again I will tell you, this is the capsule, this is zona glomerulosa, this is the zona fasciculata, and beneath that you have zona reticularis with cells that are arranged as a reticulum with anastomosing branches. So when you draw, first you draw the capsule, you have the zona glomerulosa, you have the zona fasciculata, then zona reticularis. So you draw zona reticularis like a reticulum. Okay, with anastomosing branches, you draw it as a reticulum. In zona glomerulosa, you gave cells basophilic staining. You stained it with hematoxylin. Zona fasciculata, the cells have got vacuolated appearance, so you won't give any stain, right? But zona reticularis, you stained the cytoplasm with eosin because it is acidophilic. Okay, you stain it with eosin, and you draw it in anastomosing cords and branches. Okay, so that is zona reticularis. Now regarding the hormones that are produced by the suprarenal cortex, zona glomerulosa, it releases mineralocorticoid hormones. Zona fasciculata will release glucocorticoids and dihydroepiandrosterone. Zona reticularis will release some glucocorticoids and sex hormones. You will study this in detail in physiology. Zona glomerulosa release mineralocorticoid like aldosterone, deoxycorticosterone, which are involved in maintaining the electrolyte and water balance of the body. Zona fasciculata will release glucocorticoids like cortisone and cortisol, which have got widespread effects like carbohydrate metabolism, protein metabolism. They have got anti-inflammatory effect. Zona fasciculata also releases dihydroepiandrosterone, which is an androgen. Zona reticularis can release some glucocorticoids and sex hormones, estrogen and androgen. Now coming to the adrenal medulla. Adrenal medulla, when stained with chromate salt, it will give brownish color to the cytoplasmic granules when fixed by the chromate salt containing fixator. That's why they are called chromaffin cells. And this reaction whereby it gains brownish color, that is called chromaffin reaction, and these cells are called chromaffin cells because they stain with chromate salt. In adrenal medulla, again cells are arranged in groups or columns separated by wide sinusoids, and cells are columnar or polyhedral and have basophilic cytoplasm. So this is the adrenal medulla. Okay, cells are arranged in groups or cords with intervening sinusoids. So here this is the adrenal medulla. Okay, so you can see the groups or cords of cells with intervening sinusoids. So once more I will repeat, this is the capsule. Then you draw in inverted U shape the cells of zona glomerulosa with basophilic staining or hematoxylin staining of the cytoplasm and deeply stained nuclei. Then you draw zona fasciculata as 2 cell thick with intervening sinusoids. The cells appear vacuolated because the lipid will get washed off during processing. Then you have the zona reticularis where the cells are arranged as a reticulum, as an anastomosing cords. Then you have the adrenal medulla. So this is how you draw the suprarenal gland. Thank you.